What if your body has already been warning you that your kidneys are in trouble? The scary part is, kidney disease often develops silently. Many people don't realize anything is wrong until the damage has already become serious. But in many cases, your body starts showing small, visible warning signs long before a diagnosis happens. Maybe your urine looks different. Maybe your feet are swelling. Maybe your skin is itchy for no reason. Or maybe you feel tired all the time. In today's video, we're going to break down 17 signs of kidney disease you may be able to see or feel and explain what they could mean. Make sure you stay until the end because some of these signs are subtle and some may mean you should see a doctor as soon as possible. Section 1. What the kidneys do. Before we get into the signs, let's quickly understand why your kidneys are so important. Your kidneys are two bean-shaped organs located in your lower back. They work like natural filters for your body. Every day, they help remove waste from your blood, balance fluids, control minerals like sodium and potassium, help regulate blood pressure, and even support red blood cell production. So when your kidneys stop working properly, the effects can show up all over your body, not just in your urine. Now let's go through the 17 warning signs step by step. Sign 1. 1. Foamy or bubbly urine. The first sign is foamy urine. If your urine looks unusually bubbly or has a layer of foam that keeps happening over and over again, that could be a warning sign. Why? Because damaged kidneys may allow protein to leak into the urine. Normally, protein should stay in your blood, but when the kidney filters are damaged, protein can escape. And one of the easiest ways this shows up is through persistent foam in the toilet. One random foamy pee may not mean much, but if it keeps happening, it's worth checking. Sign 2. Swelling in the feet, ankles, or face. The second sign is swelling. If your kidneys are not removing extra fluid properly, that fluid can build up in your body. You may notice swollen feet, puffy ankles, tight shoes, sock marks on your legs, or puffiness around the eyes. A lot of people ignore this and blame heat, salt, or lack of sleep. But repeated swelling can be a major clue that your kidneys are struggling. Sign 3. Needing to urinate more often at night. If you keep waking up at night to use the bathroom, especially if this is new for you, it could be another sign. This is sometimes linked to changes in how the kidneys filter fluids. Of course, there are other possible causes too, like diabetes, prostate issues, or urinary infections. But if nighttime urination becomes frequent and unusual, your kidneys should be considered too. Sign 4. Changes in nail color. This one surprises a lot of people. Kidney disease can sometimes affect the appearance of your nails. Some people develop what doctors call half and half nails. This means the upper part of the nail may look pale or white, while the lower part looks darker or brownish. Not every nail change means kidney disease, but if it happens along with other symptoms, it could be part of the bigger picture. Sign 5. Hard calcium bumps under the skin. Another possible sign is small, hard lumps under the skin. In more advanced kidney disease, the body may have trouble balancing calcium and phosphorus. When that balance is disrupted, calcium can build up in places it shouldn't be, including under the skin. These bumps may feel firm or unusual and should never be ignored. Sign 6. Poor circulation or hardening of blood vessels. Kidney disease can also affect your blood vessels. When mineral balance becomes abnormal, calcium can deposit into the arteries, making them stiffer over time. You may not always see this directly, but it may show up as poor circulation, leg pain while walking, cold feet, or difficult to control blood pressure. This is one of the more silent but dangerous complications. Sign 7. Muscle cramps. Do you get frequent leg cramps, especially at night? That can be another warning sign. Your kidneys help maintain the balance of important minerals like potassium, calcium, magnesium, and phosphorus. When those levels are off, your muscles may start reacting with painful cramps or spasms. If this keeps happening often, it's something worth paying attention to.
8. Weak bones or bone pain. Your kidneys do more than filter blood. They also help activate vitamin D, which your body needs to keep bones healthy. When kidney function drops, your bones can become weaker over time. This may show up as bone pain, body aches, weakness, or increased risk of fractures. Sometimes people think it's just calcium deficiency, but the kidneys may be involved too. 9. Itchy skin. One of the most frustrating symptoms of kidney disease is itchy skin. If your skin feels dry, irritated, or constantly itchy without an obvious reason, it may be more than a skin problem. When kidneys can't remove waste properly, those waste products can build up in the blood and contribute to itching. This itching may feel worse at night, affect large parts of the body, and not improve much with lotion. That's an important clue. 10. Restless legs. Do your legs feel uncomfortable at night, like you constantly need to move them? That may be restless leg syndrome, which can happen more often in people with kidney problems. Some describe it as tingling, crawling sensations, pulling, or a deep, uncomfortable feeling in the legs. It often gets worse at night and can seriously affect sleep. And poor sleep can make everything else feel worse too. Sign 11. Metallic taste in the mouth. Have you ever felt like food suddenly tastes off? Or maybe your mouth tastes metallic, bitter, or just strange all the time. This can happen when waste builds up in the bloodstream. Some people say, meat tastes weird, everything tastes bad, or I've lost interest in food. This change in taste can quietly lead to poor eating, weight loss, and weakness. Sign 12. Loss of appetite. That leads directly into the next sign, loss of appetite. If you don't feel like eating, feel full quickly, or get nauseated around food, your kidneys may be part of the reason. When waste builds up in the body, it can affect digestion and appetite. A lot of people dismiss this as just gas, just acidity, or just stress, but if it continues, it deserves attention. Sign 13. Easy bruising. If you notice that your body bruises very easily, that can sometimes be linked to kidney problems. You may find purple marks, dark patches, or bruises after only minor bumps. In some cases, kidney disease can affect how the blood clots or how platelets function. If bruising becomes more frequent than usual, don't ignore it. Sign 14. White powdery skin, or uremic frost. This is a rare but serious sign of advanced kidney failure. In very severe cases, waste products can become so high in the blood that they start coming out through sweat. When that happens, a white powdery residue can appear on the skin. This is called uremic frost. It's not a mild symptom. It usually means medical attention is urgently needed. Sign 15. Chest pain or pressure. Kidney disease can sometimes cause fluid and waste to affect the lining around the heart. This may lead to chest pain, pressure, discomfort, or pain when breathing or lying down. This is not something to wait on. If chest pain is happening, especially with swelling, fatigue, or shortness of breath, you should seek medical care quickly. Sign 16. Constant fatigue and weakness. One of the most common signs of kidney disease is simply this: you feel exhausted all the time. And not normal tiredness. We're talking about low energy, weakness, brain fog, poor focus, and feeling drained even after sleeping. Why does this happen? Because your kidneys help signal the body to make red blood cells. When they aren't working well, you may develop anemia. That means less oxygen is being delivered around your body, and you feel tired, weak, and worn down. Sign 17. No symptoms at all. And now, the most important sign of all. Sometimes kidney disease causes no symptoms at all. Yes, none. That's why kidney disease is often called a silent disease. A person can lose a large amount of kidney function before they feel anything obvious. That's why people with diabetes, high blood pressure, obesity, heart disease, or a family history of kidney disease should be especially careful, because sometimes the first symptom appears far too late.